Ryan Sample, behavioral health therapist at the Amon Institute for the Reclaiming Innocence Project. Amon stands for Arming Minorities Against Addiction and Disease. The Reclaiming Innocence Project was designed to provide reentry services using the care coordination approach to behavioral health, peer navigation, and housing services to include rental assistance. So, who is eligible for Reclaiming Innocence? Black people and those who identify as Black in the LGBTQ plus communities, 18 and up, and those with former justice involvement, and those who have been released from jail or prison within the last 10 years, with preference given to those released in the last 5. We want to remind those out there that the M and Amon stands for minority, so all minorities are welcome to apply. How can you get in contact to learn more about me and my program? Please email me at ryan@amod.org, and to learn more about other programs and services, please visit our website at amod.org. Thank you so much. No, I'll never forget that day. No, never forget that day.
Epiphany Counseling, Consulting, and Treatment Services provides individual, couples, group, and family therapy. Our goal is to help our clients on their journey to healing, hope, and peace of mind. We understand that every individual, family, and couple is different, and so we do not use a cookie-cutter approach. Every therapist takes their time to get to know you, get to know your family, to ensure that they can provide the best services to you. We have several clinicians here that specialize in a variety of different emotional challenges, whether it be depression, anxiety, PTSD, a mood disorder, an eating disorder. All of our clinicians are here to assist you. So why consider therapy? If you want to establish peace of mind, if you want to heal from emotional wounds, if you want to regain control of your life in general in this world where we often feel like we don't have control of anything, this is the opportunity to do so. It's an opportunity to sit once a week and solely focus on yourself. To find out more information about Epiphany Counseling, Consulting, and Treatment Services, please visit our website at www.eccts.com or call us at 424-570-6955. We look forward to hearing from you.
Hello, my name is Mark Thompson. I am a case manager here at the Good Seed Drop-In Center in Long Beach. Whereas the Black experience of homelessness is a tough road because of systemic racism and racial challenges that our clients have to deal with every day. We here at the Good Seed believe in providing a high tolerance, low demand space which gives us the ability to have a no judgment zone here where our clients are dealing with mental health issues and homelessness.
Hi, my name is Cheryl Gully, and I'm the program manager at the Drop-In Center. Along with providing our clients with a safe space, we also feel it is important to make sure our clients receive services from clinicians who are well versed in the nuances of working with clients of color. That means that the agency leadership, our clinicians and case managers are able to speak to and understand the Black experience. Our clients benefit when they work with us who are professionals and paraprofessionals that can ease the access to mental health services as well as the stigma associated with receiving mental health services. Our services here at the Good Seed include providing resources and connections to temporary shelters, permanent housing, education and employment training and opportunities, as well as referrals to area mental health providers. We want to make sure that our agency and the client experience is one that is positive and meaningful. How we deliver those services makes a difference. So we are open on Monday through Monday, 8:30 to 5:30. Our clients can come in, they can get a good hot meal, breakfast, lunch, and dinner. They can take a shower, they can wash their clothes, they can relax, take a nap, and they can utilize all the resources that we have here for them and feel safe in doing that and feel cared for. So thank you for hearing about what we do here at the Good Seed in Long Beach.
Hello, my name is Keisha Montfleury, and I am with Handiwork LLC, in which I am proud to have the position as a confidence coach for girls. What we do is we host interactive workshops and we provide resources for our girls in order for them to be able to have a healthy confidence so that she's not given into negative behaviors such as self-harm and bullying. I would like to share a quote by Frederick Douglass that I believe really shows the reason that we do what we do. It really shows our purpose. And what the quote says is, it's easier to build strong children than to repair broken men. I'm going to say it one more time. It's easier to build strong children than to repair broken men. I really want to share that quote because, like I said, I believe that that's the foundation of why we're so passionate about planting the seeds of encouragement into our young girls. We believe that mental health in the African American community is a collective effort, and in which we would like to act as a preventative measure to use our passions to be able to develop the whole child. So I just want to thank you for the opportunity for me to be able to share on the behalf of Handiwork LLC what we do. And I really hope and pray that that we're able to pull our resources and use it together so that we're able to do what we need to do. Thank you so much. Have a good day. Bye.
My name is Mayumi McKinley. I am the founder of the Healing Black Intergenerational Trauma Center, which for now is an online platform dedicated to assisting the Black community in thriving emotionally, mentally, spiritually, physically, academically, and financially.
Hi, we're with Health Advocates, and we help people with mental and/or physical disabilities apply for SSI and SSDI benefits. These are also known as Social Security Disability Insurance and Supplemental Security Income. In order to qualify, we will ask, do you have a long-term mental and/or physical disability that prevents you from doing the activities of daily living, such as going to work or going to school? And are you a citizen or legal permanent resident? For a free eligibility screening, you or anyone you know can go to our website, healthadvocates.com, and contact us with your name, your phone number, and an email address. We understand how overwhelming everything is right now, and it is mentally draining, especially for the African American community. It is important for systemic change issues to be addressed and to make resources accessible for communities in need. We want to do our part in reaching equity for the African American community. So contact us and see if we can help you with any questions, comments, or concerns you have regarding our services. Thank you.
My name is Nakia Fields, and I'm the president and chair of the board for Therapeutic Play Foundation. We are so excited to share our services with the Black Mental Health Task Force. We believe that early intervention is important for the Black community. We have experienced so many years of intergenerational trauma, and it's time for us to be preventative and proactive in our approach to our treatment and our healing. So a part of Therapeutic Play Foundation's passion is early intervention and working particularly with maternal mental health. And I think that if we start educating earlier, even in the preschool level, at childcare provider spaces, then we have a better chance of making a difference in the mental health outcomes, educational, behaviorally, and intellectually of our community. So please join us in creating a self-care routine for our community as a whole.
Hi, my name is Danae. I'm a mother of two. I am a part of Mommy Matters. I had the opportunity to join the program through GAIN, the TSC program. So they gave me the opportunity to express my love for being a mother and also help mothers that are in the same position that I am.
Hello everyone, my name is Shannon and I am part of the admin team and the support squad here at Therapeutic Play Foundation. As I help manage all the clients that we're seeing, all our awesome and amazing therapists that work here. Now, along with the mental health, we also offer yoga, we offer acupuncture. We're going to start hosting some classes with sound healing and different workshops. I'm also a Reiki healer and yoga teacher. So what I just love is that we just bring all these amazing holistic practices into the mental health world, which is so important.
Hi, my name is Melody and I'm one of the administrative coordinators with Therapeutic Play Foundation. I handle all the calls, customer service, Any questions about billing? Here at Therapeutic Play Foundation, we service Beacon. We do service EAPs, CureLink, Cigna, HealthWest Advocate. We are an external provider of Kaiser Insurance. We also serve Blue Shield of California.
So in order to find the Therapeutic Play Foundation, you can find us here at our website, therapeuticplayfoundation.org. And you can find us here at Therapeutic Play Foundation on Instagram. We also have a TikTok called Therapeutic Play.
Hello, my name is Sarah Ramos and I work for LA Care Family Resource Center. We are located at the Old County Hospital LACUSC inside the Wellness Center. Our center is one of 3 known in the community as family resource centers, but LA Care and Blue Shield Promise are committed to develop and expand community resource centers across Los Angeles County. Over the next 5 years, the health plans will jointly open 7 new centers and rename and renovate the existing 3 family resource centers. What is a family resource center, you might ask? It's actually a fun place in your local community with unique free educational classes and services tailored to meet the needs of our local communities. Who do we serve? We serve the community at large, clients with insurance under our health plan, LA Care Plan Partners, Anthem, Blue Shield Promise, Kaiser, under PASC, Cover California, CalMedi Connect, and just everyone in the community. Clients that might not have insurance or have insurance. All services are free. There is no charge for any of the classes that we offer. Unfortunately, due to the current pandemic, all of our family resource centers or community resource centers have been closed. So I would encourage you to visit us at lacare.org so you can get a quick update at when our centers will be reopening soon. Now, why is mental health so important within the Afro-American community?
I'm Haskell Jackson. I'm the CEO and co-founder of Music for Your Mental Health. I've been in the music industry for over 27 years. Out of all of the accolades that I have, being nominated for multiple Grammy Awards, to hit #1 on the Billboard charts, to running the Kanye West Foundation for over 6 years, I pride myself mostly in working with the youth. I absolutely love it. I'm from the inner city of Los Angeles as well. Our program staff consists of music producers, professional musicians, and certified therapists. They absolutely love what they do. Our goal here at the program is to foster the creation of music as a therapeutic tool for youth 4 to 18 years of age in underserved and low economic communities. We provide in-person as well as online workshops. Our goal is to combat this stigma that has lingered in the African American community for years, and that is therapy is for crazy people. It's a false narrative that has kept us in fear. Oftentimes, that has kept us from getting the resources that we really need. The benefits of the program are to enhance self-expression skills, to improve perception, communication, and social skills, and to increase self-esteem and focus. Please visit our website, www.musicforyourmental.org. We would love to talk with you. We'd love to have you. Thank you.
Hello, my name is Dr. Aziza Shepard. Myself and Shadana Weathers are the executive leadership for Ohana Center. Ohana Center is a small grassroots nonprofit with a mission to provide families with the tools they need to stay on the road to stability. We seek to support underserved, at-risk families in the Antelope Valley. Ohana Center's vision is to bridge the gap between community, family, and home life. From my own experience as a mental health clinician in the Antelope Valley, I have seen and experienced firsthand how important a better understanding of mental health can be for the Black community. Today, and as well in the past, in the United States and around the world, a storm cloud of hegemony, oppression, microaggressions, and trauma have caused an explicit divide between Black and white and rich and poor. This divide affects the allocation and distribution of economic and healthcare resources. Today, the cloud of racism casts a looming shadow of despair. The destructive forces created by the storm cloud don't hit everyone, but seem to target individuals who are Black and brown and the most vulnerable. The effects of the lightning strikes produced by the clouds of oppression are trauma, mistrust, and dis-ease. Research has shown the roots of mental health stigma and avoidance in the Black community can be linked to the enslavement of Africans in the United States and is carried on today by health systems and ideologies based on racist beliefs and practices. Mental health is important to the Black community because it is something that encompasses not only the individual, but is an intersection of community, government, laws, and access to resources. Data indicates that Black African American individuals access mental health resources far less than their community counterparts. Ohana Center leadership promotes personal and community well-being through grassroots outreach and engagement. With our mission to provide individuals and families with the tools they need to stay on the road to stability, our goal is to provide accessible resources to the most vulnerable populations of all ages who are at risk of developing serious mental health conditions, to acquire psychoeducational tools and skills through activities that reduce ongoing stress, prevent serious mental health conditions, and decrease isolation in people most at risk. Now that's Black history, that's outreach, and we hope to see you in the community. Thank you from Ohana Center.
Hello everyone, my name is Savannah Thomas and I'm here today to tell you all about the courses, services, and community impact of Painted Brain. So if you didn't already know, Painted Brain is a nonprofit organization that focuses on bringing mental health services to vulnerable communities such as the LGBT+ community and the BIPOC community. For the African American community in particular, we want to focus on destigmatizing mental illness and mental health as a whole in order to create a healthier, more equitable society for everyone to live in. In fact, in the past 6 months, Painted Brain has made a concentrated effort to focus our attention on minority mental health, and we hope to set a precedent for how similar organizations should talk about minority mental health in the future. Painted Brain wants to be a space where all members of our community feel safe and welcome to seek assistance from us or go to any of our workshops that can help them succeed professionally. It's the reason why we offer peer tech training to formerly incarcerated individuals to give them the technical skill set necessary in order to succeed in the workforce in the future. Or why we have our speakers bureau, Painted Brain Talks, where mental health survivors tell their stories of adversity and triumph. We want members of our community to see people who look like them and who have gone through the same struggles that they have, and to understand that it is possible to succeed in all aspects of life, even while living with a mental illness. Painted Brain focuses on using arts advocacy enterprise and technology services that can greatly improve the lives of all members of our community who participate in our workshops. We also offer tech advocacy and occupational therapy education training in order to encourage people to get involved and learn more about mental illnesses and well-being. Painted Brain's Community Center is located in the Pico, Fairfax, Mid-City, Los Angeles area, but we offer arts and creativity groups throughout the greater Los Angeles area. Please check out any of our social media for more information and ways to join any of our free online workshops. Thanks for watching. Bye.
Art is good for people with mental illness, or people with mental illness should aim to be artists. It's because it's a very good way to get people together and feel comfortable with each other. And it's something that's often missing in the mental health world.
My name is Rhonda Jefferson. I am a licensed marriage and family therapist in private practice with over 20 years of experience. My office is located in Redondo Beach, and I serve the Los Angeles and South Bay area, as well as all of California virtually. I assist individuals, couples, and families, as well as premarital counseling. African American people have not always been afforded the privilege of taking care of their mental health. For some, therapy has been viewed as a negative stigma. It has been suggested that therapy is for the weak, self-indulgent, and privileged. We, as African Americans, are characterized as many things, but never weak, self-indulgent, and privileged. We have been taught to keep everything in the family. Talk to your family members, friends, and maybe even your pastor. But it doesn't always feel resolved or that you have gotten closure to move on. So, we tuck away all the bad feelings and life's tragedies and try to continue to fight through all the pain, leaving secrets in the closet, hoping no one opens the door, diminishing our quality of life. You are constantly doing things for others. It's your turn. Take the time to do something for yourself. 2020 has been a challenging year for so many reasons. The isolation of not being with family and friends, the death of loved ones, possibly losing your job, not to mention taking on the responsibility of educating your children at home. The racial uprising and the stressful election has caused a lot of us to feel overwhelmed and full of anxiety. We are also dealing with a lot of unknown factors going forward. COVID conditions may have you feeling a little off. We can talk about it. If you're ready to take that next step, I am here to empower and support you on your journey to wholeness. I can be reached at 310-291-6613. It's time to live your best life. Thank you.
SHARP is a field-based community mental health agency in the South LA area that serves a predominantly minority client base. SHARP provides a low to an intensive level of mental health services that include therapy, case management, psychiatric, medication support, and integrated health care to clients of all ages suffering from a variety of mental health conditions and co-occurring disorders.
My name is Latoya Rucker. I'm a peer specialist at SHARP, and serving in the African American community is important to me because I can share my lived experience in helping clients overcome barriers when it comes down to racial injustices, also dealing with depression, anxiety, and also racial disparities.
So my name is Kasima Thomas. I am a peer specialist here at SHARP. So when I think about the importance of mental health in the Black or African American community, I think of a word vulnerability. And in most cases, people look at being vulnerable or vulnerability as a weakness, when in essence, in truth, vulnerability is the courage to embrace something different. Mental health in the same aspect, how do we move people to embrace mental health when in the Black community has had a stigma associated with so long that pushes people away from it, and people don't want to be associated with it because, the idea of you're weak because you need that kind of help.
Hello, my name is Robin Williams. Mental health in the African American community is essential because of a lot of the stigma that has been associated with seeking mental health services. In order for us to properly heal, we do have to address the vicarious trauma, the generational trauma, the things that we deal with, the racial injustice, societal, systemic racism, those things that are impacting our day-to-day lives as well as generationally. So here at SHARP, what we want to do is we want to offer help to those who need the help, because seeking mental health services is not a sign of weakness or a character defect, but it's actually a sign of health and strength. SHARP, because mental health is essential.
I'm Michelle Perkins.
Hello, I'm Tanisha Merriweather.
Hi, I'm Yehuda Price.
And we are from Turning Point, a nonprofit agency in South Los Angeles, which was founded by Michelle Perkins, a formerly incarcerated Black woman who served 5 years in prison and has her own firsthand experience with childhood trauma. She now employs formerly incarcerated community members and others in our predominantly Black and Brown community because Turning Point's mission is for the community healing. We provide all sorts of reentry services to our community, from 1,000 pounds of free food a month to women housing and job support, mental health support, and other social services. We are connected to the pulse of our community because we are the community.
And I'm a clinical social worker that knows firsthand what the lack of access to mental health services can lead to. There's this stigma in the Black community, especially amongst Black males, around seeking mental health services. In our community, poverty, systemic racism, and other situational factors often conspire to marginalize the most vulnerable among us. For myself, untreated trauma contributed to me responding in maladaptive ways that landed me in prison. I served over 16 years in prison after being arrested as a teenager and was released a little over 2 years ago. Turning Point was there for me soon after I got out. Since then, I've attained my bachelor's degree, my master in social work degree from the University of Southern California, and I'm currently a doctor of social work student. Here at Turning Point, our lived experience allows us to form an especially deep therapeutic alliance with our community members in order to bring about change in individuals and our community as a whole. At Turning Point, Black mental health matters.
Hi, my name is Imani Bradley, and I work with UMA Community Clinic for a program called BVAL, which stands for Black Visions of Wellness. The goal of this program is to reduce the stigma of mental health in the Black community and encourage individuals to seek treatment. To qualify for the program, some of the qualifications are for you to identify as Black, African, or African American and live in LA County. We do provide services for both youth and adults. As a part of the program, we offer counseling, case management, and holistic treatment. Holistic treatment includes services such as chiropractic care, acupuncture, massage therapy, Reiki, yoga, meditation, journaling or poetry, and the list goes on. We continue to develop new programs, services, and resources based on community interest and needs. It's important for the Black community to seek mental health services because the brain is a complex organ and we really don't understand the effects of mental health symptoms on our body. If you want more information about our program, please contact us at bval@umaclinic.org. That's bval, B as in boy, V as in Victor, O-W, @umaclinic.org. Thank you.
Uplift Family Services has evolved over 150 years to deliver behavioral health services to California's children and their families. Each year, we help over 30,000 children and family members recover from trauma, such as abuse, severe neglect, and poverty, covering over 30 counties in California. Here in the Los Angeles region, we help the most vulnerable children and families in the Metro and South Los Angeles communities from our offices in Hollywood and Linwood. As we celebrate the enormous and important contributions of Black Americans this month, we remember that while we have made significant strides, structural racism and inequality are still pervasive in our society and must be dismantled before we can call ourselves a more just and perfect union. There is still much work to be done, and today we will briefly summarize a range of Uplift Family services aimed at offering hope and healing. Hollygrove is privately funded. Through our generous donors and grants obtained, Hollygrove offers services free of cost to support wellness in our community. Hollygrove offers Hollygrove Haven, currently a virtual program for elementary school-aged children and their families to receive support in navigating online learning, managing difficult behaviors that impact learning, offer one-on-one homework help, academic groups, and social emotional groups that teach about values, coping skills, with trained staff that support children build their self-esteem. Hollygrove also offers Parent Institute. This program provides a space for parents to learn new skills, support one another, and grow their supportive network. Parents learn the importance of modeling and how to inspire children and how to create teachable moments during everyday life. Parent Institute is offered in English and in Spanish and is conducted virtually. It's open to all parents and caregivers in the Los Angeles area. For more information about Hollygrove programs, please contact our office at 323-543-5660 or email us at hollygroveservices@upliftfs.org.
Outpatient mental health services are clinic-based and community-based treatment services using evidence-based practices for individual, children, and adolescents with serious emotional disorders and for family members in crisis. Our services are strength-based and needs-driven, with an individualized treatment approach that emphasizes collaboration with natural supports in the family, school, and community. Our school-based services provide early intervention and therapy to children, adolescents, and families who are suffering from a mental health issue. We truly value the partnerships that we have created with our 17 schools, which include charter and LAUSD schools in Hollywood and South LA. Even more so now during these difficult times, amid the struggles of distance learning, we continue to be part of the school environment, their assemblies, their social media, and their parent meetings. In addition to mental health services, we also facilitate monthly parent workshops and have covered a variety of topics, including how to set up a study area in the home, how to cope with the pandemic, and our most recent one about grief and loss. Based on the high need of recent requests from our school partners, we will be presenting the Grief and Loss workshop to high school students in the near future. We provide this space for parents to learn about mental health and how to get connected with services. We provide parents with community resources depending on the topic.
Uplift is a pioneer in the wraparound philosophy for California. We believe the most effective form of care for children, youth, and their families is based in the community, where we can build upon a foundation of support. Offered out of both of our Hollywood and Linwood sites, Wraparound is designed for high-risk kids and adolescents with the most complex needs. Partnering with DCFS and probation, these services aim to keep children and their families together through individualized services developed in a family-centered team planning process. Services are provided at home and in the community. Wraparound provides services that are sensitive to the special and unique needs of each child and family we serve. We work with children and families to develop relationships that are therapeutic and healing in order to reduce the negative impact of experiences that may have been traumatic, racist, or abusive. Wraparound attends to the whole person, to more than just mental health, to include factors that support and impact mental health, such as basic needs, educational needs, legal, recreational, social needs. Wraparound provides collaborative services that are individualized, customer-driven, community-based, and culturally competent and relevant. Wraparound consistently and regularly checks in with youth and families to make sure we are competently addressing needs, challenges, supports as the family perceives it. We do this by suspending our own belief systems, making every effort to listen to our families, to understand each child and family's values and beliefs, to see the world from the child's family's perspective, and to provide the services that the child and family identifies as necessary.
From our Linwood office, we provide a more intensive level of care. The Intensive Field Capable Clinical Services, or IFCCS program, serves children and transitional aged youth up to 21 years old with an open DCFS case who have had difficulties maintaining a stable placement. With our IFCCS program, we have the ability to follow our youth if they change placements anywhere within LA County. This ensures a level of stability within the youth's mental health services. Services include individual and family therapy, medication support services, monthly meetings with the youth CSW to collaborate and support the youth's needs, case management, trauma-informed services, and linkages to community resources. The goal of Full Service Partnership, or FSP, is to stabilize high-risk children and their families and provide them with whatever treatment services or resources they need to stay at home, recover from mental illness, and remove barriers that prevent them from achieving healthy levels of functioning. Our FSP program services the communities of Compton, Watts, Linwood, and South LA. FSP is available to severely emotionally disturbed children between the ages of 0 to 15. Although intensive mental health services are the cornerstone of the program,
FSP also offers case management services, medication support services, transportation assistance, living expenses, housing, food, and daily living skill building. Like our sister agencies, we made the pivot to providing mental health services through telehealth and have become skilled at outreach, caregiver, and family engagement, assessment, treatment planning, and evidence-based interventions. We continue to work to bridge the digital divide by providing case management services in order to link our families to the resources they need to participate in their treatment.
Oftentimes, when faced with challenging or troubling situations, our communities of color or BIPOC seek support within their family unit, their friends, and/or their church communities. Historically, rejecting the structured organizational systems due to feelings of anger, fear, mistrust, experienced injustices, and unfairness. In turn, mental health services can be viewed negatively or as an indicator of something being wrong with me, my kids, my family, breeding the stigma and misinformation. This thinking discourages accessing care, asking for help. This thinking contributes to sustaining generational cycles of poverty, of limited and inadequate educational, medical, and housing opportunities, of substance misuse, of legal system involvement, such as probation and incarceration. At Uplift, we humbly aspire to support in disrupting such cycles. For more information or to make a referral, contact Veronica Alanez, our intake coordinator at 323-769-7171 or 323-793-3988. Her email and our school mental health services referral form are on this slide. Uplift Family Services is here for you.
Hi, I'm Michelle Perkins.
Hello, I'm Tanisha Merriweather.
Hi, I'm Yehuda Price.
And we are from Turning Point, a nonprofit agency in South Los Angeles, which was founded by Michelle Perkins, a formerly incarcerated Black woman who served 5 years in prison and has her own firsthand experience with childhood trauma. She now employs formerly incarcerated community members and others in our predominantly Black and Brown community because Turning Point's mission is for the community healing. We provide all sorts of reentry services to our community, from 1,000 pounds of free food a month to women housing and job support, mental health support, and other social services. We are connected to the pulse of our community because we are the community.
And I'm a clinical social worker that knows firsthand what the lack of access to mental health services can lead to. There's this stigma in the Black community, especially amongst Black males, around seeking mental health services. In our community, poverty, systemic racism, and other situational factors often conspire to marginalize the most vulnerable among us. For myself, untreated trauma contributed to me responding in maladaptive ways that landed me in prison. I served over 16 years in prison after being arrested as a teenager and was released a little over 2 years ago. Turning Point was there for me soon after I got out. Since then, I've attained my bachelor's degree, my master in social work degree from the University of Southern California, and I'm currently a doctor of social work student. Here at Turning Point, our lived experience allows us to form an especially deep therapeutic alliance with our community members in order to bring about change in individuals and our community as a whole. At Turning Point, Black mental health matters.
Hello, my name is Tyler Howard. I'm a community ambassador here at the Children's Center of the Antelope Valley. And what I do here and what most of my colleagues do, we help transitional age youth in the Strategy 3 program. And we also have a Strategy 5 as well. Strategy 5 deals with legal justice involved. The demographics we reach are, we help all races, all demographics, all ages, genders, sexual orientation. We offer legal assistance through our multiple subcontractors, so anyone who may have any records, anything like that, they may need expunged, where there's a possible route that we can help with that. Employment services, peer support, mental health aspect. We have Painted Brain, we have clinicians on site as well, and therapists that you can discuss with and we can also refer you out to other programs as well. Medical services at Bart's Altadena, food assistance as far as groceries, hot meals, many items. So to touch on why I think mental health is important in the Black community, through my personal experiences and maybe lived experiences and things that I may have seen and learned about over the years, my personal experience talking to a therapist, even just having the space to breathe and discuss how you feel about what's going on in your life through an unbiased and unparalleled outlook, you can get a lot done. It's a space where you can just literally just have, you would like to talk if you need someone to listen. If you think about it, a lot of people may not have that alone. And here at the Children's Center, we have Painted Brain for our participants that may be interested. They have a lot of different sessions. And right now during COVID, we've been doing a lot of virtual sessions. You do like group channels. You sit down, they have like a lot of interactive settings, so it's not as awkward. You get a lot of help that way. You can talk to a therapist one-on-one, you can do over the phone sessions, whatever makes it comfortable, it's here to help you. So for anyone that's interested in our referral process or joining our program and becoming a participant, I would definitely recommend, even if you know someone who fits the age demographic, we do have 16 to 25 for our Strategy 3, that's the Transitional Age Youth, the TAY program. And then for Strategy 5 or anyone legal justice involved, call the Children's Center of the Antelope Valley and we'll refer you directly to our intake department and see if you qualify. And even if you don't qualify, we don't turn anyone away. We always will refer you out to someone else or somewhere that can assist you properly.
Hi, my name is Amber and welcome to Westmont Counseling Center. We are a community mental health clinic providing quality and affordable care to the residents of Westmont and the surrounding South Los Angeles area.
My name is Victor Gabriel. I am an associate marriage and family therapist here at Westmont Counseling Center.
My name is Priscilla, and I'm one of the associates at Westmont Counseling Center.
Hello, my name is Kevin Orange, and I'm also known as Twin. I was born and raised in South Central Los Angeles. I have dedicated my life to bringing peace to the community and working with gang interventionists.
I believe Westmont Counseling Center to be beneficial in multiple ways, one of which is treating those who are dealing with unmet needs, the needs that get unnoticed, depression, anxiety, trauma, abuse.
One of the things that I appreciate about being a therapist here is the resilience that is present in the community and the way that Westmont builds partnerships and builds partners within the community that we serve.
My name is Erica Martin, also known as Nehigh. I was born and raised in South Central Los Angeles, just as well as my daughter and my grandson. I'm very grateful for WCC. I first came here to take a class on trauma, and that class had taught me about trauma and taught me ways how to heal from trauma from my past. I can't tell you how helpful the class was for me.
I think what makes Westmont Counseling Center really special is its dedication to the community and its commitment to healing for all. We would love to assist you in your healing journey, and we can't wait to meet you.